before we get started, this meeting is being recorded and live streamed on TVW. This meeting will be shared on the State v. Blake ESB 5476 page, and it is open to public disclosure, so please do not disclose any private or confidential information. Next slide, please. There will be 10 minutes at the beginning of the meeting and 10 more minutes near the end of the meeting reserved for public comment. Each person will have 3 minutes to provide their feedback. If you are not a committee member and would like to make a comment during a particular discussion, please raise your hand for facilitator awareness, and public comment on that topic will be invited before moving on to the next item. Feedback that's not provided during the meeting can be submitted via email at any time to hcaesb5476@hca.wa.gov. And with that, we'll just move into a roll call here. All right, Michael Langer.
Present.
Amber Leaders. Senator Dingra. Senator Braun. Just a reminder to mute yourself if you're not speaking for the meeting. Yep. Thanks, everybody. Sorry, Senator Braun. Representative Davis.
Good morning.
Good morning. Representative Griffey. All right, I believe Caleb's out today. Don Julian Saucier. Janelle Wolf. Alexi Orr.
Good morning.
Amber Daniel. Randy Flood. Stormy Howell.
Good morning, present.
Good morning. Chad Enright.
Good morning.
Good morning. John Hayden.
Good morning.
Good morning. Nikki Lewis.
Good morning.
Good morning. Sherry Candelario. James Tillett. Christine Lynch.
Good morning.
Morning. Sarah Gillard.
Good morning.
Good morning. Donnell Tanksley. I believe Malika's also out today. Addie Adwell. Kevin Ballard is also out. Hunter McKim. Curtis Klingenberg. Representative Taylor.
Good morning.
Good morning. Representative Mossbrucker. All right. With that, I'll hand it over to Michael for some opening comments.
Thank you, Michelle, and welcome everybody to our November SURSAC meeting. Really appreciate you being here this morning. As we are in the month of November, it's customary to think about what we're thankful about. And I'd just like to take a moment to acknowledge those that are working day in and day out to help individuals that need our support, who are having challenges related to substance use or substance use disorders. But also the entire continuum, quite honestly, those that are working in primary prevention, intervention, outreach, engagement, treatment, recovery support services, and everything in between. We know the challenges of the workforce shortages that we're having, and the fact that people are putting in extra effort and have been for a very long time. So I would start off the meeting just being very thankful, whether you are out there starting up new homes for people in recovery to live in, or folks that are currently using to have a roof over their head. We are thankful for you, all the treatment providers, and again, everybody that's out there supporting those that we care about so deeply. So that's what I'd like to start off our November meeting with, and just really appreciate you all being here today. I know we have a variety of conflicts, as we heard what Michelle was doing the agenda. So thank you for those that can be here. And Michelle, thank you for organizing the agenda and getting us ready for today. I will, at this point, we were going to have Curtis introduced, but I don't believe he was on.
Right, and I just double checked. He's not here yet.
He's not able to make it.
Yeah.
Okay. So if and when Curtis joins, we will take a moment and give him an opportunity to introduce himself. We also want to welcome those on the call this morning that may not be SURSAC members, but are guests. Welcome you as well. And I'm going to turn this over to Blake Ellison. I should have maybe started with the fact of my name is Michael Langer. I'm chairing the SURSAC committee, and I work as a deputy director with the Division of Behavioral Health and Recovery within the Healthcare Authority. So again, thanks everybody for being here. And Blake Ellison is our facilitator of these meetings, and I am going to turn it over to Blake, who's going to lead us in some public comment if we have such. So Blake.
All right, good morning. And we have 10 minutes for public comment. If you're a member of the public and you would like to make a comment, please just go ahead and raise your hand, and we will allow you 3 minutes to make any comments that you would like to make. Again, calling for public comment. See no hands. Last call for public comment. Okay, Michael, doesn't look like we have anybody this morning anyway. We'll see if we have anybody in the later in the session.
Thank you, Blake. And I believe we're going to go ahead and move on to Brianna Peterson, who is going to talk to us about the SURS Plan Progress Report. And we spoke about this at the last meeting, and you all had some questions. And so Brianna is going to give us an update again for our November meeting here today. So Brianna.
Thank you, Michael. I am Brianna Peterson. I am the technical plan developer for 5476. Sorry. I want to thank you all for your feedback during the last meeting, during and after. So I wanted to start off with that. And we did receive some feedback that I wanted to just go over very quickly. Some of the feedback was surrounding the safe supply research. We did adjust the language to clarify the current status of safe supply happening here in Washington State. One of the other comments was regarding the formatting of the recommendations, and we did restructure them to be a little bit more clear and to include, what part was the recommendation that you guys put forward, how the legislature responded, and any HCA implementation updates that we had up to that point. We have also internally, we also decided to include a table just to have like a quick review of the recommendation, the legislative response to those recommendations, and any funding that might have been tied to those recommendations. I do want to touch on that one of the SURSAC members highlighted that maybe we could have a section for committee member feedback and commentary regarding legislature, their response to the recommendations. I just wanted to say that we will continue to have discussions over the next year regarding these implementations, and we will continue to uplift the recommendations that come from their committee regarding the legislative response to the SURS plan, and any subsequent implementation efforts. As the state agency, we are able to implement elements of the SURS plan to the extent that is supported by legislature and any available funding. And those are the updates that I wanted to give. Any questions? Okay, thank you.
Thank you, Brianna. And I've had a chance to look over the latest draft and really appreciate the modifications and updates based on the feedback. So thank you so much. I've also mentioned, James, if you're on, your camera is on, but you're not. I don't know if you know that or not, but you might want to adjust the camera. Or there you go. We can see you now. Thank you. Thank you for being here. Okay. Next, we were going to go to the community safety panel discussions. And this is a bit of a debrief that we'll turn over to Blake, and he's going to lead us through. Just wanted to get a sense of, after the last several meetings of having the panels, whether or not the committee wanted any further discussion before we move on to other things in future meetings. So Blake, I'm going to turn this over to you and see where we are.
All right, Michael, thank you. So actually, I'm going to turn it over to Michelle because she's got some direct questions she wants to follow up on. So thank you, Michelle.
Yeah, thank you, Blake and Michael. So we can go to the next slide here. We sent out a survey a few weeks ago asking for SURSAC members to answer a few questions in preparation for this discussion. 3 SURSAC members completed the panel discussion survey, so we actually won't be sharing a summary of the responses as we had planned to do, in order to protect the privacy of the few who responded and not really call out their specific responses, since there were just the 3 of them. But for those who did respond, we want to thank you so much for taking the time to do that and provide your feedback. And we have reviewed all of your responses. And again, just thank you so much for that. So we spent, 3 full meetings inviting folks to speak on the topic of community safety and substance use. And we heard from the folks that you see displayed there on the screen. And before we move on from that, we just wanted to create a space to talk about any key takeaways that you've had, anything that you learned, anything that has shifted for you as a result of those conversations and hearing from this wide range of people. So this is the time to do that. And whether or not you already completed the survey, we want to hear from you and just know what your key takeaways were. So go ahead and raise your hand if you have anything to share about that. And if it's hard to see the names that you want to be reminded, you can hit Control and then scroll in. That enlarges the screen.
I'm going to take the silence as a indication that when we had the panel come in and have the conversations, that there may have been enough time in those meetings allowed for you to ask your questions and to have enough conversation that you felt like you got out what you needed in those meetings. I recognize some of you may not have been out to all of these presentations either, so maybe you're a little apprehensive to comment given the fact that you may not have been in the meeting, but we just want to make sure we gave the committee enough time for discernment before we move on to future items. So if you feel comfortable, we can go ahead and move on. But if you did want to kind of reflect more than you already gave it during those individual meetings, this is the time to do that. So can we just pause for pause for a few more minutes or moments, and then if we don't hear, we will move on. Looks like maybe there's a couple questions coming in, and then also I think as part of this discernment is also if there's voices you want to hear from in the future, it'd be good to know that as well. So I'll turn it back over to Michelle, and she'll facilitate the answer.
Sure. Yeah, James, I see your hand up. Go ahead.
Thank you. So I know I did complete this survey, and I know some of my answers might have seemed critical, but I do really love that we're putting so much effort into everything that we are with the SURSAC committee. And so if any of my answers seemed critical, it was more reflective of what is locally happening, not statewide. But I do feel, I feel like we need to hopefully find a way to get better engagement. And I know it's a process, but I love that we're still having these conversations and bringing everything to the table and listening to everyone's perspective within these discussions.
Thank you. And Deontay, go ahead.
Can you hear me?
Yes.
Yes. Happy November, everybody. I can honestly say I really loved these discussions. They have, of course, at times as y'all know, sometimes there could be times where we want to take a deeper dive into some of these disparities that some of these people have been impacted with. But overall, I was very happy with just that the SURSAC actually displayed this, so then we can see what we can be working on, what we can take a deeper dive in, how we can be able to build. Yes, it has been challenging. Yes, sometimes we went back and forth because as community folks, we might feel that there is more that ACA can do. But I do think that this is exactly what the SURSAC has been, how we can be able to continue to work together. What else is what is missing, we can continue to try to challenge and do this as a collective members as Washingtonians in this state. Usually I can shake up a table and have a lot to say, but throughout there is more conversations to be had. I really did like the criminal justice system was the most challenging one, where I kind of felt away. Sometimes when you hear a prosecutor talk about how your people are, it can come off hurtful. But I do think that as we move forward, next year we can kind of start off, if we have more recommendations that may come out next year or the year after, we can continue to move as a collective together. And that was my rated G version of what I wanted to say. But I'm coming in peace today. So
Thanks, Deontay. There is always that email address you can use for whichever version.
Absolutely.
Outside the meeting. Yeah. Thank you so much for that feedback. Yeah, anyone else have comments about just the panel discussions in general, or anything you learned from maybe one of the individual speakers, or ideas for folks you'd like to hear from in the future?
Okay, I'm sorry. My last 2 cents. Sorry, Michael. But I do want to, we need to be pushing more inviting or contracting or bringing in more conversations with our community members from the trans community. We know that, especially in rural counties in the state, we know that when it comes to housing, when it comes to the criminal justice system, crisis response, and harm reductions in community services, some of these policies aren't we need to make sure that we're ingraining different discussions and policy when it comes to our trans brothers, sisters, and non-binary folks in this state. It is always a miss. It is always a miss when we are ingraining some of those the policies and recommendations when a lot of them aren't in the state. And what can happen for King County is completely different from what's happening in Ilwaco. It's completely what is happening in Spokane County. So I would love to see a bigger push for trans community members in our community. That's all. Sorry.
Don't have to be sorry.
I'm done for now, Michael, but I'm coming back. So, okay.
Thank you.
I'd follow up, Deontay. I think that I hope I continue to be a life learner and to appreciate the different perspectives that we're bringing forward. It sounds like many of you do as well. And so I think I reflect over the past few months. I actually really appreciate the diverse perspectives that come from the community into these meetings. It's one thing to be insular into the meetings or into the committee, then walk outside and then hear other perspectives going on. So that to the degree that we can bring the different perspectives to the table and have conversation, I think we can all learn that way, and we probably do as well. So you know, I think about the individuals served, but also those that are serving individuals in the community as some of the more powerful feedback we heard, right? The systems issues are important too, and making sure we have the right referrals happening and an understanding across different lines of the system. So I don't want to discount that, but I will say I'm hearing directly from those that are in the community what's working for them, where their challenges still lie. And as Deontay said, particularly if you might be in Ilwaco or Republic or Raymond versus Seattle or Kent or Tacoma or something. So just, again, a lot of appreciation for those that came forward, and a continued call out. If there's other voices we want to hear from, if there's other parts of the state we want to hear from, please let us know that. It makes us all richer if we can have those conversations. Thank you so much.
James, I think your hand is up again. Yes, go ahead.
Yeah, and in regards to like panelists we would like to possibly hear from in the future, I wrote in the chat, but I would like to hear from like anyone that's comfortable doing this, but hearing from a panel of success stories, but then also a panel of those that didn't feel like the process served them, and so we could learn on where there might be some gaps, where we're missing on things. And then also with the providers, individuals that work the RNP program that had success, and then vice versa, maybe former employees of that program that, because those two demographics are going to have the best, concept of what's working, what's not working with the boots on the ground. Just kind of hearing more balance on success and failure, so we can see where that middle ground is to find the most optimal process moving forward.
Thank you, James. Anybody else? Maybe folks that who haven't shared yet or haven't had a chance in previous meetings to share? It would be helpful to open the survey back up. We can also do that if you would prefer to share your responses that way. Just let me know in the chat if that's an option you would like.
I think we maybe also be inferring that folks want to look forward and see what else we want to have come. So I appreciate, Michelle, you put time on the agenda today. So we have, everyone has an opportunity to share their voice. And, thank you all.
Come on, y'all, share your voices. We want to hear from y'all. It's been a good 2 years. We need to hear something.
Nikki said maybe open the survey. And Nikki, if you weren't here for the meetings, that's.
We do, yeah. So for any members who are new, like Nikki, thank you. I see in the chat, you weren't able to. You just joined the committee, more recently, and so weren't at those meetings. For anyone that missed the meetings, those recordings are up on the State v. Blake website, and so are the meeting notes. So if you want to catch up that way and take the survey, provide feedback, that's also an option. So got another chat message from Danielle Fleming. As a guest, the emerging adult ages 18 to 27 years old is a population of need to provide resources when in early remission. Thank you for that. Great, Susan PC, the link in the chat to the website, is that what you mean? I'm gonna assume that's what you mean. I'll find that with the meeting recordings. Yeah, okay, great. Yep, I'll get that in the chat for you. All right. So I think we're all right to move on. And I'll be sharing the link to the survey again for folks to have a little bit more time with that. So Rachel, next slide, please. So the next agenda item is talking about this continuum of housing follow-up. So recommendation number 18 from the Substance Use Recovery Services Plan, we just felt we weren't being as clear as we could be about how we're implementing that and following up with it. So we wanted to do a bit of an overview here. Thank you. So this is the language from the plan around this recommendation. The committee asked the legislature to appropriate capital and operating funding to support immediate shelter options, bridge or transitional housing, and long-term permanent housing at various points along the continuum of care, including housing for those who actively use drugs and those in recovery, which may or may not include abstinence. So next slide, please. I want to point out what is in the report, the progress report related to the action taken by the legislature per 5536 along the continuum of recovery housing. So I won't read through all of those bullet points, but those are the different pieces of the legislature in 5536 that the legislation that address that. And I think what may have been causing some confusion is that there wasn't something there clearly for folks that actively use substances, but we do as a state, as you know, HCA does have a model for that, and it's housing first. And so what we wanted to do today is provide some more information about that existing program and how it's being expanded, so that folks are aware of that opportunity for folks on that end of the continuum of use and the housing options that are available to them. And before we move on to that, and Lisa, you're up next for your presentation. Lisa Bennett-Perry, I just want to cover one more thing. Next slide. Yeah. We do have a recovery housing advisory group that is a space where people who are vested in recovery housing can come together to collaborate and share. Meetings are held quarterly, and it's open to members of SURSAC or other individuals with a vested interest in recovery housing. So we'll have more information about the winter meeting coming in January. If you are interested in having, in receiving that information, please let me know in the chat or over email, and we'll be sure to get that information to you. Just wanted to let you know that that is an opportunity available for collaboration. And with that, I'll pass it over to Lisa Bennett-Perry to tell us more about the Housing First model and the expansion happening in the state.
Thanks, Michelle. So again, I am Lisa Bennett-Perry. I'm with the Division of Behavioral Health and Recovery. I'm the Recovery and Community Supervisor, so I work in the Recovery Support section. So what we wanted to start out, let me go ahead and share my screen. Slideshow. Let's try this again. Oh my goodness, everybody's frozen. I don't know if you can hear me, but everybody's frozen. So I'm going to leave and log back in.
We can hear you, Lisa, but I can't see your shared screen. It's just black.
Yeah, it just, I'm going to log back in. I'll be right back.
While Lisa's doing that, I would share something I learned last week around housing, and it's not the housing first model per se that we're going to hear about today, but more of our overall capacity around recovery housing in the state of Washington. And we're pretty proud of and feel like we're leading the nation in many respects for the capacity of the houses we do have. But I had not realized how close to the milestone number of 500 that we were. And I think if you add together the Walker homes or those on that directory and the Oxford homes, we're getting close to 500 total in the state. You multiply that times 5 or 10 folks that can be in these homes, and there's thousands of folks at any given time in the state in these houses. So I thought I'd share that with you. I know we get into the weeds of details, things a lot, but kind of lifting up and kind of getting a bigger picture. It's just really nice to see that capacity continue to grow. And in addition to that, we have several other housing models and housing supports and things that Mo has shared with you and that you're hearing a little bit more about today too. So I'll be quiet. Maybe we got Lisa back on and talk about housing first. So,
Yeah,
Lisa,
thank you. I'm going to go ahead and turn my camera off just in case that was the problem.
Good.
All righty. So we wanted to give you some updates on the Housing First expansion for fiscal year 23. So just a reminder, DBHR was tasked in Proviso 96 to create and expand access to no barrier and low barrier programs using the Housing First and harm reduction model. These models are designed to assist and stabilize housing supports for adults with behavioral health conditions. And housing supports and services are made available with no requirements for treatment for their behavioral health condition, and supports must be individualized to person's needs and wants. Why Housing First? Housing First key principles: immediate access to permanent housing, services with no housing readiness requirements, choice and self-determination. Housing First is a right-based, individualized, person-centered model. Recovery orientation, not simply focused on meeting basic needs, but on supporting recovery. Individuals and person-driven support, recognizing that individuals are unique and so are their needs. And social and community integration, social supportive engagement and the opportunity to participate in meaningful activity. And I know I'm speaking to the choir when I say why harm reduction, but I want to go ahead and do it anyway. Harm reduction aims to reduce the risk and harmful effects of substance use and addictive behavior for individuals in the community and social and society without requiring abstinence. It emphasizes the choice that people must think for themselves and follow the path they want. And harm reduction works by addressing broader health and social issues through improving policies, programs, and practices. Little Housing First research which shows Housing First led to quicker exit from homelessness and greater housing stability over time compared with treatment as usual. Emergency department services, fewer hospitalizations and less time hospitalized compared with treatment as usual. And it also increased in outpatient services versus inpatient services. And a huge impact on quality of life. Having a place to live and the right support can lead to other positive outcomes beyond provided by exiting services. Housing stability, quality of life, and community function outcomes were all more positive for participants in Housing First program. So it's not just about housing people, it's about recovery. Just a little reminder, how we chose the 10 agencies in 8 regions to provide the housing or to contract with Housing First services. We asked that agencies, we prioritized agencies that had internal housing units available, and that were committed to prioritizing individuals and family experiencing behavioral health challenges and the Housing First model. Agencies that are in the process of internal housing units as well. When the proposal came out, it actually was in partnership with Department of Commerce. And originally, the ask was that Commerce would have capital funds and DBHR, HCA would have the services, and then we'd work together to make this happen. It was on Commerce's side, it was never allocated for the actual budget for this, but they were doing a lot of other great things with providers. So we worked with them to identify some of these providers that had projects in the works. HCA priorities aims to demonstrate diversity, inclusion for marginalized and underserved populations. Here is the 10 agencies that received the grants for Housing First. Here's the regions that were covered, or excuse me, the counties that were covered. The Housing First staffing model was that each agency would have 2 peer counselors, 2 housing specialists, 1 supervisor, and on case-by-case basis would have also a residential manager, knowing that the Housing First services and property management should be separated. So now for the outcomes. So as I said, 10 agencies in 8 counties received contracts in January of 2023. Housing First agencies hired staff between January and April or so. So total individuals served between January and June of 2023 was 408. The living situation upon enrollment was there was 209 people that were houseless. 146 were unstably housed. So just kind of a little bit of information, more information is that the Housing First agencies can work with people that are at risk of losing houses, not just people that were literally houseless. And so, and then 51 were temporarily sheltered. So out of the 108 of the 262 that was either houseless or temporarily sheltered, 41% of them received housing. It was a relative, very short period of time for this 408 people. Now for new housing resources, which is just a little bit also very exciting, I hope. So 55, 36, 33, and I don't know how to say, but 8. The amount in the subsection are provided solely for the authority to provide short-term housing vouchers. We also interchange that with subsidies, just in case I say subsidies and I don't want to confuse you, for individuals with substance use disorders, with a focus on providing these resources to people in the 5 most populous counties of the state. That included King, Pierce, Snohomish, Spokane, and Clark. And that's $7.5 million over 2 years. The plan is 60% of these funds will go to current housing providers by way of a low barrier application. Priority will go to agencies that can demonstrate an established history serving LGBTQIA+ communities, Black, Indigenous, and other people of color, immigrant communities, women, and youth. Grant information sessions will be held November 15th and November 16th. Michelle will follow up with sending that flyer out to you after this meeting and the PowerPoint. Another thing I wanted to make sure that I said was priority. Sorry, I'm trying to open my Word document and not do that. I just wanted to highlight that priority will go to, given to agency, I can get this. Priority will given to agencies that have established history of providing housing services to target population, and the overall budget per year is $450,000 per county. The number of agencies that receive these funds will depend on the amount of interest and qualified candidates in each county. And there will be allowable 10% administrative cost for each agency that receives these funds. The proviso is not intended to fund housing services, but instead meant to enhance current housing services by offering housing vouchers / subsidies. And I'll pause because I might run out of breath. And then in addition to that, the remainder 40% will go to recovery housing operators, with a portion that will be used to hold bed space for individuals who are waiting for treatment. Ooh, sugar. And then I wanted to also share 5187-102. There is $5 million over 2 years from the opioid abatement settlement amount that's provided solely for the authority to provide short-term housing vouchers for individuals with substance use disorder. These resources have been attached to DBHR's homeless outreach programs to include PATH, Peer Pathfinder, Host, and Recovery Support Services. The goal is for programs to have immediate access to housing subsidies for their currently unhoused or at risk of losing housing. So that is actually going out in contracts as we speak. And here's a map of where the subsidies are going with our PATH, Peer Pathfinder, and the other outreach programs. So there's 9 regions, 11 counties, and 18 providers that the subsidies and vouchers will be going out to. And then here's my contact information. If you have any more information, Michelle will be sending this out afterwards. Thank you. Any questions?
Deontay, yep. Deontay, go ahead.
No, yes. Thank you so much, Ms. Perry, for your presentation. I've seen there that in November we'll be rolling this out. Will there be a push to be reaching out to other entities? My only concern with this, right, because I'm so excited about this, and we've all been working hard throughout these meetings to push this. So now that it's here, how can we, I just want to make sure that we're getting a good rollout to other entities. I've already discussed some of the housing entities that are constantly getting the same funding, but to make sure that, as we've seen in there, Black folks, elders, young folks, and LGBTQIA communities are funded for this. How do we push it for them to get just as much funding as the usual entities that you usually fund? Does that make sense? I can call out entity names, but I'm really trying to, it's November, so I don't want to do that.
Actually, it's a wonderful question. And we just did a startup we're doing a startup for an education and employment program, which had some of the similar language in it. And we went out to our normal HCA distribution list, but we also send it out on the tribal distribution list, the peer community distribution list, and my team and I worked handpicked, trying to reach out to agencies that maybe wouldn't have been contacted, that would have fell into the category of serving primarily persons that may be identified as BIPOC, for example. And to get some diversity that we didn't get before. So that being said, you're more than welcome to contact me to give me some ideas of agencies that this could go out to that might not be on the distribution list. I'd be more than happy to work with you on that.
Thank you so much, Ms. Perry. I would really appreciate that. I would love to meet with you. I'm already working with LGBTQI entities and told them that this will be coming out. So I would just love to meet with you with some of those entities, because my concern, and I'm just saying this to everybody, with some of these fundings that are coming out, we have to make sure, and it is our duty, especially members and community members that are coming into this meeting, to make sure that we're talking about the entities that aren't always getting funded, because there are there are entities that are getting millions of dollars per year, but they aren't prioritizing a lot of Black and Brown organizations, entities, LGBTQIA, et cetera. So I would love to meet with you to push this. And I'm just saying this on the recorded line because I would hate to get to November next year and then see that we didn't follow through. And I'm saying we because I know we're working here as a community collective. Thank you.
No, I would love it. Look forward to it. The contact information will come out to you.
Thank you, Ms. Benapari.
Mhm.
Any other questions? All right, don't see any. Thank you for the presentation. Appreciate it. Okay, it looks like we're moving right along today. We have public comment up next. So we will give another 10 minutes for public comment. If anybody from the public would like to comment, please go ahead and raise your hand virtually and we will call on you. You will have 3 minutes to comment. Again, looking for public comment.
One in the room. There's a question in the room.
Yeah, please. Hi.
Hi, Shelley Wilder. Can everyone hear me? I don't know where the mics are.
Yeah, we can hear you.
I just wanted to talk briefly about the plan of the SURSAC and how the community safety discussions are great, and I appreciate HCA reaching out and finding community members doing the work to come and educate us. I believe a body making decisions should all be on the same education field. What I would like to see more time is that we have a group of an amazing subject matter experts just in the SURSAC. So I would love to see more. I would like to see more expertise pulled out of this body right here, and see more engagement with the great minds in this committee. Because I believe a big part of the SURSAC was to also educate HCA doing the work. And so would love to see more of that happen. That's all. Thank you.
Thank you, Shelley.
Thank you. Any other comments? All right, last call. All right, Michelle.
Yeah, thanks, Blake. So that actually brings us to planning for the next meeting. And it would be great to know if you want that next meeting to be December 4th or wait till January. Might be nice to have a little break during the holiday season, but that's up to you all. So if you, and this is a quick poll for SURSAC members only as committee members. So if you would like to meet on December 4th, please put your hand up. And then, if we have more than half of the folks wanting to do that, we'll do that. And otherwise, we will wait till January. But yeah, go ahead and keep your hand up if you want to meet in December.
Can you say what will be on the agenda, if you know?
Oh, yeah, so I was gonna cover what goes on to the next agenda once we knew when we were meeting, Deontay, but yeah, great question. Okay, so it looks like only 3 SURSAC members want to meet in December. So we'll go ahead and have the meeting in January, the next one.
Oh, no.
Okay.
Oh, sorry.
That's all right. All right, so you can put your hands down unless you had a comment. James, did you have a comment or was that a voting hand?
Voting hand. I just
Okay. So with the time that we have now, we certainly don't have to go all the way to 11 o'clock, but since we do have the time, I would really like to hear what folks would like to discuss in the January meeting. Last year we had a bit of a year-end review time, and then we did a Menti to find out what it was that you wanted to cover in the coming year. We could do something similar like that. But I also would just like to hear what ideas for what to cover in the January meeting. Or I can put an agenda together myself as usual and get feedback after a draft is put together. I would love to hear your thoughts.
Possibly opening up some more panel discussions, kind of like what we talked about earlier, just kind of hearing from people that have had success, whether it's the provider or the recipient, if they're willing to, just kind of revealing how far we've come, with this process, and just kind of getting to hear more from the people that are really engaging in the program and providing that service.
Yeah. Are you referring to RNP, James?
Yes, to RNP.
Yeah, okay.
Yes.
Yeah. Okay.
I'll throw one out there to see where the interest is. We should be seeing the governor's proposed budget mid-December. So a December meeting would have missed that anyway. But we would get that. We could share the substance use disorder or behavioral health in general investments in the governor's budget in early January, if that would be of interest to the group as well.
Just raise your hand or let us know in the chat if you'd like to hear more about that. All right, and I see a comment from Susan that normally we would hear at the December meeting, we'd hear the RNP numbers presentation, like to see the Q3 numbers. Yes. Okay, noted. Yeah, and we are still working on the data dashboard to be presented publicly. So once that is available, we'll actually have a link with those numbers that you can look up by quarter. So we won't have to wait for a meeting to be able to share those numbers with you. But I'm going to write that down to make sure that we've got those, that we're sharing those quarterly numbers one way or the other. And Christine Lynch says yes on the budget update. Yeah. Okay. So something else that I wanted to talk about in terms of communication throughout the year is, we've got the annual report that needs to be drafted pretty early on, like August, in order to have time for our internal review. So the data and the updates from that are not necessarily fully up to speed by the time they're submitted in December, which is fine for that report that's meant to cover the fiscal year. But we need another way to let you all know the more current updates with implementation for what's going on. And so I'm curious if anyone has thoughts about how to do that, if you want to wait till meetings to do updates on things like the Safe Supply Work Group and RNP updates that aren't necessarily the data, or housing updates, all of these different projects that are coming from 5536. There's a lot to cover, and so I'm just wondering how you as committee members would prefer that to be communicated, if we need to have like standing agenda items on the meetings for certain things, or what would work well for you. You can always email me outside of the meetings if that's easier. Need some time to think about it. Yeah, Deontay, go ahead.
Yes. I did want to recommend like some of the things that I would like to hear or discuss in some of these meetings. I would love to hear from some of the state representatives on what some of the things that they're working on in the state. Um, when it comes to policies around or surrounding community members that are impacted by substance use in their state or initiatives that they are trying to push. I think that this is just a great opportunity to start as we had conversations about 5536. We did hear we didn't hear very much of like where people stood on certain policies, but just kind of just wanted to get got little to no answers in that space. So I really want to just hear what's going on, and also I want to hear what's going on in other counties that people could be pushing that will affect the state as a whole. So I would love to hear from some of the state representatives, which Representative Davis, Representative Taylor, I appreciate the work that you do. I would love to hear in this space some of the policies that you are working on towards that.
Can you say, Deontay, sorry, policies toward what specific policy area?
I'm sorry, community members that may be impacted by substance use, like how we've had a discussion about 5536. What there could be other things that could be coming down the turnpike that could affect some of our community members that are impacted by substance use in the state thereafter, if that makes sense. So what would that look like? Does that make sense? Am I making sense? Michael, nod your head if I'm making sense.
Yeah, originally I was taking notes that you wanted to hear from state agency folks who were implementing programs that we may not have showcased yet. The more that you spoke about it in the question, I think what you were asking is for state elected officials to maybe come on and talk about some things that they're sponsoring during session. Is that more of the ask?
But yes, in the movement around the plan. Thanks, Amber, because that's pretty much what it is, right? Because we know that, things may get amended or what have you. We just want to make sure that I want to, and then also out of respect, these community, the state representatives are actually going to the state and having discussions kind of or around some of these, the policies that we have in this plan. So what does that look like? How can we support those efforts? And how can we move as a collective with our stance on that, if that makes sense?
So we could ask our state legislative members if they want to share some things prior to session that they'll be working on. It sounds like what you're asking.
Look at this. Look at me and Michael in November, nodding at each other. We are agreeing with each other. See, look how good God is. Yes. Yes, that is exactly that.
Okay, thank you.
Yeah, I'll just chime in. That may be because session starts January 8th. So what is the date of the January meeting?
I don't think we have scheduled 2024 meetings yet, actually, but usually it's the first Monday of the month. So
that's New Year's Day. I only see that
not that
if
day.
we want to honor Deontay's, our schedules get sort of gobbled up, and it's pretty difficult to schedule during session because of committee blocks and such. Although actually first thing Monday morning can sometimes be okay. Caucus sometimes doesn't start until like 10 o'clock in the morning. So maybe lawmakers could attend that first hour.
Rep. Davis, would it be better, I'll maybe use that word, what if in December we didn't hold sort of the traditional meetings that we've been doing, but we just had like a legislative hour and had the legislative members talking early December about their thoughts leading into the upcoming session? Does that feel like there's enough time to plan for something like that, or the timing work better for that?
Yeah, I could see that if we wanted to invite perhaps some other colleagues who may have beyond those of us officially appointed to the SURSAC, but who may have behavioral health related legislation or legislation of interest to the committee.
All right. I know folks voted not to have a December meeting, but if that's something that, the group would be interested in, we could maybe plan something for December. So Thank you for the feedback.
Alternatively, I think we could probably pull it off if we did it. And I can't speak for the Senate, but in the House, we typically start caucus, I think, at 10 o'clock in the morning on Mondays. They haven't released, though, the committee, whatever it's called, the session planner it's called, that actually indicates all of that. But if history repeats itself, you know, we probably could pop in that first hour.
In January instead of December.
Correct. And we may actually have a better idea at that juncture what's actually going to go live and is actually baked enough to run this year at that time.
All right. So maybe keep January, try to do it early enough and maybe reach out to folks to make sure we have time before the official meeting start today. Okay. Thank you.
That would be like a Thursday meeting or something.
Do it early enough.
Excellent. Yeah, that's a good idea. There was a comment about a shared, from Juliet, a shared space of reports for committee and where we can share videos and other resources as well. There is something called WA Portal, which can be used for that purpose. So that would be something like basically a website where members can post resources. I can share things, post reports, other documents. So that could be a good hub for sharing resources together. So thank you for that. We can talk about how to use that if we want to use that in 2024. And I see the comment from Amber that we need updates, heads up on movement around the issues in our plan. Yes. Okay. Any other thoughts or ideas for the January meeting? All right. Yeah. All right, I think we can wrap up there then. Thank you all so much for being here and all of the work that you've done throughout the year. There's been so much progress made, and I guess that's all. Do you want to make any final comments, Michael?
Just enjoy this month of gratitude, I can say. And also just really like hearing the comments of hope. We talked about those that are serving people that are in need of services, but it's great to see the opportunities that have been afforded us in the state to offer hope to people. Let's just keep building on this, and I appreciate all the feedback today and look forward to seeing you all. If not December, we'll see you in early January, so enjoy the holidays and take care, everybody.
Thanks, everyone.
Everybody.
Yeah, Merry Christmas. Happy
Happy holidays. Yeah.
Happy holidays. Yeah.
Take care.